All right, so as I promised you in the last lecture, I'm going to show you how to do buttock and hip massage. Now, first of all, why? Because it's very seldom taught. And if it is taught, it's just like a very short amount of time, right? But if someone comes in and you see people that come in, they don't want to take their shorts off or their underwear off. And so, like I said in the last lecture, how do you do it, right? What is a really good, someone's got hip pain, buttock pain, I've seen this time and time again, where people are just too shy, they don't want to do, so you need to be able to do this, right? So what I've got for you is a video from my one of my trigger point courses. So I thought I'd keep in where I talk about treating the trigger points, because if you're going to learn how to do the techniques, you might as well learn where the trigger points are, and as you'll see, I make it super simple in my trigger point courses. So this will show you not only how you can do the massage through clothing in the hip and buttock region, but also how you can address the trigger points that might be causing sciatica, hip pain, whether it's lateral, whether it's back around the sacrum, and whether it's lower back pain as well. All right, so have a look at this, and then for the next time someone comes in, whether they've got pain there or not, you're going to be able to do absolutely fantastic work through your forearms. Let's go straight to the video. All right, so now we're going to do the buttock region. So you can see the graphics here. You've got the trigger points for gluteus maximus, gluteus minimus, which we're going to add to, and also the piriformis. Right, let's do this. So once again, you wouldn't go full on straight in with elbows. I'm using the heel of my hand here, fingers and heel of hand, and just kind of get a feeling of what's going on here. Massaging them, just doing some nice oscillations, using my heel here, getting a feel for what's going on underneath there. Again, remember this start is not only going to give them lovely massage, but also it's exploratory. What are you feeling there? And again, if you're new to massage and you don't have very good palpation skills, don't worry, they'll come just with a bit of practice. But remember, the pads of your fingers will be really sensitive. That's your best spot to palpate. And that's exactly what I'm doing. I'm working deep circles here, getting a feel. So you see here, now I'm around about that gluteus minimus, just by the head of the trochanter there. Coming up to more gluteus medius. So you see, just working around those glute medius. Again, if you've forgotten where those glute medius trigger points are, go back and have a look. So just working through my heels. It's really nice to do some deep work with the heels here. Just like you would in any part of the body, you've got to just warm up the area. You're not going to go just gung-ho straight in with the elbow. Now, if it helps you, close your eyes for concentration, just get a better feeling of what's underneath your hands. Okay, so now we just start doing some nice forearm work. So again, this is still pretty broad work. So you can see what I said to you at the end of the last video, how I have my hand leaning on the table. By all means, lean on the table. Make it easier for yourself. So now I'm starting to focus on this elbow here. Now I'm on those trigger points, piriformis and your glute medius, glute maximus, I beg your pardon, right up by the sacrum there. So just show, there's your top of your ilium, right? So I just showed you that was the distance between the great trochanter, hip bone, and the ilium, just to give you an understanding of where I'm at. So now I'm just using that, feeling those going across those fibers. So you can see the way the fibers run. Going across them. And of course, just showing you different techniques. I'm just using my fingertips so I can feel those fibers there, feel for those trigger point areas. So we're going across them. So I can feel there with my finger, I can feel it. And again, because ilium's small, I can use it very easily and just, as you see here, pressing into the trigger points with my fingers, just pressing in like that, no problem at all. A bigger client, you might need to use your fist, you might need to use your forearm, your elbow. So again, you'd be wanting to get feedback from your client. How's that? Is everything okay there? Is that pressure okay? So I'm up around here. Once again, going for that glute max point. I'm just showing you a different way using double thumbs. Before I use my elbow, forearm, you can use your double thumbs. So this is that point, glute max, if you have a look there, and the piriformis point, especially as I said to you, if we're focusing, someone says, no, it's really sacral pain, this sort of thing, it's like much more, then I'm going to focus more on this. Now I'm coming out to the piriformis. See, I'm going across the piriformis, finding the tight bands, and bang, I found that trigger point through there. So I'm just showing you, you could use your thumbs, double up your thumbs, especially if your palpation skills, or you're just not used to using forearms and elbows. And back to the same piriformis and glute maximus point. Now, I'm coming down, you see those lower points in the glute max there? I'm coming down towards those now. So, see that there? Those are those lower gluteus maximus points. You see at the bottom of the buttocks there. Now just work my way up. So you can see we're really covering that whole area. And again, like I said to you, if someone's got more lateral hip pain, you're going to work those points that are going to be more likely to be affected, the ones that are more lateral. So now just do some nice rolling, some nice gentle work, rolling, nice tie technique. Again, when you're doing it, you feel those tight muscles and you concentrate on them. So now I'm just showing you treating the person on the same side. So especially when you want to do the glute medius and minimus, because you're at the side of the hip here. And then you just easily just push in. So you can do it either way, but once you want to get around to, certainly once getting further around to the front. And I'm just showing you can also use your elbow and your forearm, no problems at all. Be wary that is more tender, more sensitive on those areas outside there. So you just have to back off your pressure. So just showing you can use your fists there, if your thumbs get a bit tired. Working through the piriformis area. There's the great trochanter there, right? Right, so now on that lateral piriformis trigger point. You see that one? Right on that piriformis trigger point. Now, of course, if someone had hip pain, outer thigh pain, be definitely going for that. Okay, coming up to that other trigger point there in the piriformis and the glute max there. Just off the sacrum. And again, it's easy enough to locate. You just follow along the piriformis up to the sacrum as you're going across it. So again, just doing some nice massage strokes with the heel. Just showing you can use fists, heel, thumbs, everything. All right, practice time.